Girl, do not even get me started on last night. I had 5 patients. 3 of them were altered mental status. I had 1 on Lasix with no Foley. Don't even. Last night was a terrible night. I'm just trying to give you a report so I can go home on time.
I'm sorry to hear that. I was looking at her labs, and some of them were really off.
Oh, well, I mean, she was fine for the most part, but yeah, I forgot about the labs. Sorry. Yeah, Miss Love, she's like a 65-year-old Caucasian female. She was diagnosed with, it looks like stage 3 colorectal cancer. She came in last night to the ER complaining of dizziness, weakness, and standing, and just tired. She told the ER doctor she'd been feeling that way and thought that it was just her chemo.
Right.
But then she was pretty tacky with orthostatic hypertension. So the previous nurse in the ER thought maybe she could have been dehydrated. But then when her labs came back, especially because she looked pale, they were 7. And you know me, my night was busy. I was not about to start something else. So she was groggy and sleepy, and I just let her sleep. So I haven't even been in the room.
Isn't 7 dangerously low? What did the doctor do about it? Any transfusion?
I mean, it's been forever since I looked at labs like that. I mean, I think it is. You know how long it's been since I've been in nursing school?
Yeah.
You new grads or something. You'd be fine. Whatever. I think he talked about putting in an order for a transfusion, but you'll be fine. You got it. You got it.
Thanks for the encouragement. This
Right.
will be my first blood transfusion in my own, so
Well,
I decide to give her one.
I just checked now. I think the order, well, it looks like this consult order where he was talking to her just popped up, so sure lucky day you'll be given a transfusion.
Okay.
And I'm about to be out. So
All right.
You have a good
You
day.
look tired.
I am, girl. I am.
Hi, Miss Lowe. My name is Zara, and I'll be your nurse today. How are you feeling? Oh, the light. I'm sorry.
I don't feel good. I'm so tired. I've been feeling like this for a few weeks. You know what this doctor gonna do for me?
Well, I looked into your chart, and I know he talked to you about doing a blood transfusion.
I guess, honey. I don't even know.
He hasn't put in an order yet, so we have to wait for that. I have to call him for that. But your hemoglobin being so low, so this is an urgent issue.
I guess, honey. I guess. I've been feeling like this for a while. You know I got cancer, so I just had the chemo.
Right.
So
I can only imagine how you feel. I'm so sorry about this. I'll get you the consent form. You can sign that, okay? And then,
Yes, honey.
yeah, and then I'll rush and go get him to do this. All right, basically it's just saying that you acknowledge blood transfusion, just what the doctor talked to you about. All right.
What does this say?
All right, let me go.
This.
Hey, Miss Lowe, my name is Jennifer. Can I take your vital signs?
Okay, sweetie.
All right, I'm gonna check your blood pressure, Miss Lowe.
Okay, honey.
Blood pressure is a little low. Let me check your temperature. I'm gonna check your pulse. Uh-oh. Temperature's a little high, blood pressure's a little low, and your heart rate's running a little bit fast. Are you okay?
Honey, what do you mean, uh-oh? What's my temperature?
Your temperature's about 101.
Oh, Lord. What am I going to do? Honey, I just had chemo. I can't go through this anymore. Somebody needs to fix this.
Well,
I'm not feeling good about getting this blood, honey. Somebody needs to call this doctor and tell him I'm having second thoughts. I was going to say something earlier, but I was just scared to say something, honey. Honey, oh my gosh. Oh, Lord.
You know, don't worry about
It's
it. You
getting
need
hot
that
in here.
blood transfusion. Is there anybody I can call for you to make you feel better?
Yes, my daughter.
Okay.
Oh, Lord.
I'll call your daughter.
You know what, nurse? I don't have time for this. The patient's hemoglobin is 7. I know you're a new grad and all. I don't have time to put these orders in. This patient needs the blood. I suggest you do it before I go to your uppers and write you up.
Dr. Johns, I've already told you I can't give this blood without any order placed.
Well, you know what? You're going to hear from your nurse manager, and that's final. Give the patient the blood.
Hello? Hello? Dr. John?
Hey Zara, I gotta tell you about Miss Lowe's vital signs. Her temperature was high and her blood pressure was low and her heart rate's high. And she wants to talk to you about the blood transfusion.
I just finished calling the doctor, and he yelled at me and threatened to write me up. I'm trying to do my job. This is not what I signed up for. I'm not going to call him again. You know? I'll go talk to her. Thank you. Hi. I know this, CNA told me that you wanted to talk to me. Is everything okay?
No, honey. Did she tell you what my temperature was?
Yeah, she said it was 102.
Yes. Oh, Lord. I'm so worried about that. You know I got cancer. And I
Right.
just had chemo. And I tell you, honey, I just can't take this much more. I don't want to get sick again. Do you know? I've been Googling. It tells me that this blood has diseases in it. Oh, my goodness. I don't want to get another disease. I already got cancer. Oh, Lord.
Look, calm down. Listen to me. The bloods have been tested for any drugs or illegal substance or even diseases. If they had it in them, they wouldn't give it to you, okay? Think about the risks and the benefits. If you do get this blood, you'll get better and bounce back to yourself, which is what we want so you can play with your grandkids. I know you were telling me about it. 1 second. Hello? It's loud. Hello? Oh, okay, thank you. That sounds perfect. Yeah. That was just Lab telling me that everything is said and done.
Oh, honey, hi. It's my daughter.
Oh, okay. Oh, great. You're here. How are you doing?
I'm good.
My name is Zara, and I'll be your mom's nurse. I need you to witness this signed consent form.
Okay. What's this for?
Just saying that she needs the blood and she'll get it and she agrees to everything.
Honey, I still don't understand what more. Oh, Lord.
Great. Thank you. Any questions?
No.
Okay. You have a good day.
Yeah, honey, you're good to sign the blood out. That's yours right there.
Okay, that's all I do?
As far as I'm concerned.
Thank you. Have you seen the nurse?
I haven't seen any nurses all day.
Well, I need to give this blood, so can you come check it out with me?
You know what? I'm in nursing school, and we did this in Sims Lab the other day. I'll grab the Y tubing and the saline and meet you in the room.
Oh my god, I couldn't ask for better help.
Thank you. Okay. Hey Zara, I already got the saline hanging for you, and I hooked her up to the saline. So I'll go ahead and do her pre-blood assessment. If you want to do your first check, and after her assessment, I'll check it behind you.
Okay, you've done this in nursing school,
Oh
right?
yeah, we did this in Sim Lab, and I got an A in that one.
Oh, good. I'll keep an eye on it.
All right, I'll listen to her lungs for you.
Okay.
If you grab for me, Miss Love. All day. All right, her lungs are clear to auscultation. Her skin looks okay.
Yeah, I'll be there.
I don't.
Okay.
We'll let you stay covered. Since I don't want to make you uncomfortable, but I'm sure your skin looks okay on your face, so I'm sure you're fine. I'll check that blood for you. Oh, okay. Are you leaving?
Yeah, I need to go. They're calling me. My patient is out of bed.
I'll stay in here for
Just keep an eye on her.
minutes. Sure.
Call me if you need
sure.
anything, okay?
Okay, sounds great. I'll check that blood and I'll just get it started for you.
Thank you.
Okay.
Hello?
All right, B positive, Miss Lowe. All right, looks like your blood type is a B positive. Is that right? Okay, well, I'm going to get this blood running. It's going to make you feel much better. I'll stay in here for 15 minutes. You just let me know if you feel bad, okay? All right.
Did you verify the armband?
I mean, it don't look like she's got a blood band on her. I see her ID band, but no blood band.
Oh boy. Let me just ask the other nurse. Did you chart her in my name?
I sure did.
Okay, good. Did you put in the initials of the other nurse
I
that it's
did.
okay?
Mhm.
Okay. Let me go ask about the armband. I'll be back, okay?
Okay.
Keep an eye on her.
Yeah. You'll be okay.
20 minutes later.
Oh, hey. What do you mean my kid's sick? I can't leave. I'm at the hospital. Well, you know what? I'm just going to have to call his dad to come pick him up. Yeah, I'm hanging blood right now on this patient. She's got low hemoglobin. Yeah, I'm in nursing school, so I'm allowed to do stuff like that. Yeah, let me call his dad, because you know I can't leave right now. All right, these patients depend on me. All right, bye.
2 hours later.
Miss Lowe, I have got to go. My kid got sick at daycare, and I have got to call his dad. You know, it's been about 10 minutes. Your blood looks good. It's running in fine. I'll send one of the nurses in to check on you, but I have got to handle this.
3 hours later.
Can you move it along? I'm all out of time cards.
I need a nurse! Help! I need a nurse!
Are you okay?
I don't know. I didn't hear breathe.
Where's the CNA?
My back is hurting.
What happened?
Why were you not in the room?
You know what? I had to take care of daycare, but I mean, this is your license we're talking about. I'm not a nurse.
Who cares about dinner?
Do you know what to do now?
Can you get someone for me?
Yeah, I'll go get a competent nurse. How about that?
I'll get a doctor!
Can you give me an IV kit?
Okay, code blue, code blue!
Oh my God! Hi, Dr. Cook. This is Jennifer, the nurse for Miss Lowe. I was just calling because her hemoglobin was about a 6.5 this morning. Are you going to transfuse with her with some blood products this morning? Oh, okay, great. You already put the order in. Let me just check that. Perfect. Did you do the practitioner attestation of consent already? Oh, great. I'll go ahead and do everything I need to get her blood going. Thank you so much, doctor. Oh, hey, Zara. I'm glad I ran into you. Would you be able to witness this consent for me for Miss Lowe? Her hemoglobin's low. I have to transfuse some blood. The doctor's already put in the order and done his attestation. Sure, yeah. All right, perfect. Okay. Call me when you're done. Okay, thanks. Thank you. Hi, how are you doing?
Good.
My name is Jennifer. I'll be your primary nurse today. And this is Zara. She's here. She's going to help witness the consent. First of all, can you verify that your name and your date of birth?
Judy Lowe, 1/1/1965. Based on Cone Health Workplace Accountability, it is important that we all address issues, even occurrences or never misses. In a situation where the nurse did not check the ID immediately, another nurse should have come to her, pulled her to a side, and addressed the situation, as this could have been a possible issue with patient safety. It is always in the best interest to take care of the patient and keep them safe.
Miss Lowe, I'm here because your doctor has ordered blood for you. Has he already come by and talked to you about what's going on with that?
Yes, ma'am, he did.
Okay, do you feel pretty comfortable? Do you have any questions about the procedure?
No, I think I'm good.
Okay, okay, great. Well, if you have any questions, let me know, and he'd be happy to come back and further explain.
Thank you, honey.
So I'm just going to have you sign this consent form. Have you had any blood reactions in the past?
No, I don't think I have.
Okay, great. Zara, you mind signing as a witness? Yep. Non-family member. Thank you. Thank you. Although in the first scene, I was in nursing school and had been learning how to do the blood transfusion process, I should never have agreed to check the blood. It must be a licensed nurse doing the blood check process. And she's right. I should have never asked her.
Okay, Miss Lowe, I'm just verifying your hemoglobin levels. They are low. The doctor has already put the order in. So Zara here is checking your vital signs before we transfuse the blood. And I'm just going to listen to your lungs if that's okay with you.
Okay.
Take a couple of deep breaths for me. Alright, your lungs are clear. Your skin looks good. Doesn't look like you have any redness or rashes here. How are her vital signs looking, Zara?
Pretty good. Her blood pressure is 128/72.
Okay, I'll go ahead and put these in. And we'll go get your blood. So Miss Lowe's vital signs look great. However, if her temperature had been above 100.4, I would need to call the doctor and verify that he or she would still want me to transfuse the blood. Miss Lowe, can you tell me your name and your date of birth, please?
Judy Lowe, January 1st, 1958.
Okay, perfect. I'm just going to verify in your chart that we have an order to transfuse. All right, looks perfect. The order looks great. And I see that he has done the practitioner attestation of consent. Perfect. I'm just going to run through a couple of checks here to make sure we give you your blood safely. All right. Let me see your blood bank band here. I'm just going to do a couple of checks here. Okay, perfect. I'm checking the bag for excessive clots, air, and abnormal color. Everything looks good to me.
Hi, Miss Lowe. Can I verify your name and date of birth?
Yes, it's Judy Lowe, and it's January 1st, 1958.
Alright, sounds good. I'll go over. Alright. Alright. So. Okay. Okay. One more check. Okay.
Looks good. Okay, let's sign the bag.
Alright. Thank you. In the last hospital video, I failed to check that the patient had a blood bank ban. In an event that you forgot to do that, you need to obtain the new type and class match from lab.
So Miss Lowe, I have your blood running. I just want to remind you to please let me know if you experience any abdominal pain, any pain in your flank area, any chest pain, or any shortness of breath, okay? And I'm going to stay in here with you for 15 minutes. Let me know if you're having any signs and symptoms of a reaction. Okay.
Meanwhile,
So Miss Lowe, at the end of these 15 minutes, I'm going to recheck your vital signs to make sure everything is okay. And then I can leave the room, but I will be coming back to check on you frequently. And at the end of the blood administration, which will be before 4 hours, I will recheck your vital signs again. I will be checking on you frequently, but as I said before, if you're experiencing any problems, please push your call button and let us know. Someone will come in right away.